Welcome to the deep dive. Today, we're tackling something really, really fundamental to U.S. healthcare.
That's right.
Medicaid's huge role in mental health.
It's massive.
Yeah, it might actually surprise you to learn that Medicaid is the single biggest payer for mental health and substance use disorder services in the country.
Hmm.
We're talking about funding around 25% of all treatment costs.
A quarter of everything. It's hard to overstate.
Exactly. So we've been digging into some recent analyses to really get a handle on this.
Good sources.
Yeah. And our mission today is basically to, unpack Medicaid's impact on mental health, look at the challenges, the disparities, which are significant, and maybe peek ahead at some future risks.
A full picture.
We hope so. And here's a stat that really jumped out at me. Over 35% of non-elderly adults on Medicaid have a mental illness.
That's striking.
And within that, 10% are dealing with serious mental illnesses, things like bipolar disorder or schizophrenia.
So we're talking about a population with really significant needs.
Absolutely. Okay, so let's start unpacking this. What's the fundamental scale here?
Well, the scale is just immense. Medicaid isn't some small program on the side. It's a core piece of the mental health infrastructure. It covers around 72 million Americans.
Wow.
Yeah, that includes low-income adults, kids, pregnant women, elderly folks, people with disabilities, a really wide range.
And the services, what kind of things does it actually cover?
It's pretty broad there, too. You've got essential stuff like psychotherapy, inpatient treatment, medications,
Prescription drugs, yeah.
prescription drugs, crucial crisis care, and also those really important community-based interventions.
Okay. And, it's interesting when you compare access. How does Medicaid stack up against, say, private insurance or being uninsured?
That's a key comparison.
Yeah.
So in 2023, about 59% of Medicaid enrollees with a mental illness got treatment.
Okay, 59%. How does that compare?
Well, for privately insured adults, it was around 55%, and for the uninsured, just 37%.
So Medicaid is actually doing better, or at least comparable to private insurance, in getting people some treatment.
In terms of overall connection to treatment, yes. And particularly what's interesting is for those with moderate to severe mental illnesses, the treatment rates reported were actually higher for Medicaid enrollees compared to those with private insurance.
That really does challenge some common assumptions, doesn't it? That maybe Medicaid isn't providing adequate care.
It does. It suggests that, for all its challenges, the program is a critical pathway to care, especially for those with more serious conditions.
So what do you think is behind that? Why might Medicaid outperform private insurance for more severe cases?
Well, it's probably a mix of things. Medicaid, being a public program, often has a clearer mandate to serve people, regardless of the complexity of their condition. Private plans might have different incentives. Also, some Medicaid programs are specifically designed for long-term support for serious mental illness, focusing on community care.
That makes sense. And wasn't there a big shift with the Affordable Care Act, the ACA?
Oh, absolutely. The ACA's Medicaid expansion was a game changer.
How so?
It basically allowed states to expand eligibility to adults with incomes up to 138% of the federal poverty level.
Which brought in a lot of people who weren't eligible before, right? Unless they were, like, pregnant or disabled.
Exactly. It removed that barrier for millions. An estimated 21 million people gained coverage through the expansion.
21 million.
And here's the connection back to mental health. Nearly 30% of those newly enrolled individuals had a mental health condition or a substance use disorder.
Wow. So the expansion directly impacted this population in a huge way.
A massive way. It opened the door to coverage for many who desperately needed it but were previously shut out.
And did we see actual results from that expansion in the states that did it?
Yes, the data from expansion states is pretty compelling. They saw definite increases in people using mental health services.
Okay.
Fewer reported delays in getting care, and really significantly lower suicide mortality rates in some studies.
Lower suicide rates, that's a powerful outcome.
It really is.
Yeah.
And you see specific examples like adults with depression in expansion states had higher rates of insurance coverage, obviously, but also better access to the care and the medications they needed.
So real improvements in people's lives and health.
Definitely. But it's not just about the direct health benefits either. There are wider economic effects.
Like what?
Well, think about medical debt. Having Medicaid provided financial security, helping people avoid that crushing burden.
Right, which is a huge stressor in itself.
Huge. And it also helps stabilize safety net providers, hospitals, community health centers that serve a lot of low-income folks. It offset some of their uncompensated care costs.
Okay, so expansion brought clear benefits, but it's not all smooth sailing, is it? You mentioned disparities earlier.
No, definitely not smooth sailing. And
Yeah.
this is where we need to get critical. Despite the progress, major disparities persist within Medicaid mental health care.
Let's dig into that. What kind of disparities are we talking about?
Well, a really big one is racial and ethnic disparities. People of color make up the majority, about 60% of those still left in the coverage gap in states that didn't expand Medicaid.
So they're disproportionately affected by the lack of expansion.
Yes. And even among those with Medicaid coverage, Black, Latino, and Asian American enrollees tend to access services at lower rates compared to white enrollees.
Why is that? What's driving those lower access rates?
It's a tough mix of factors. Cultural stigma around mental health is still a big barrier in many communities.
Uh-huh.
Then there are provider shortages, which are often worse in historically segregated or underserved areas.
Meaning fewer therapists or psychiatrists available nearby.
Exactly. And specifically, a lack of culturally competent care that understands and respects diverse backgrounds. That leads to mistrust, makes people hesitant to engage.
And I remember reading something about regional differences too, not just based on race, but geography.
Yes, that 2023 NIMH study you mentioned earlier highlighted that as quite interesting.
What did it find?
It found patterns in emergency department visits for mental health crises among Medicaid enrollees. In large urban areas, there were higher rates of ED visits for schizophrenia.
Okay.
But in smaller cities, anxiety disorders were more likely to lead to an ED visit.
What does that tell us?
It often points to unmet needs for regular, ongoing outpatient care in those different kinds of communities.
Mm.
If people can't get consistent support, things are more likely to escalate to a crisis requiring an ED visit.
And a big reason for those unmet needs seems to be that not enough providers actually take Medicaid.
Right. That's a huge piece of the puzzle. The numbers are pretty concerning.
How bad is it?
Well, one major study found only about a third of mental health providers in the counties they looked at were serving Medicaid patients.
Only a third. Wow.
And in many of those areas, it was fewer than 5 active providers for every 1,000 Medicaid enrollees.
That sounds incredibly low.
Yeah.
Why aren't more providers taking Medicaid?
The big culprits are usually low reimbursement rates. Medicaid just pays less than private insurance or Medicare.
Yeah.
And the administrative hassle. Lots of paperwork, complex billing. It deters providers.
Which brings us neatly to the sort of broader challenges facing these services. Funding seems like a really big one.
It's absolutely central. And there are serious threats on the horizon. Potential federal budget cuts are a major worry.
Like what kind of cuts?
Well, you hear proposals, like those discussed in relation to Project 2025, that could fundamentally change Medicaid funding. Things like lifetime caps on benefits or block grants.
Block grants meaning states get a fixed amount, right? Regardless of need.
Exactly. States get a fixed chunk of money, more flexibility, but also the risk that if costs or needs go up, the funding doesn't keep pace. That could threaten coverage for millions.
And are we seeing impacts already?
We're seeing the potential fallout. Facilities that rely heavily on Medicaid are vulnerable. Think of Spencer Hospital in Iowa. 40% of their psychiatric inpatients are on Medicaid. They're facing real closure risks.
Losing a facility like that would be devastating for a community.
Absolutely devastating,
Yeah.
especially when resources are already scarce.
And you mentioned the low reimbursement rates earlier. Can we put some numbers on that? How much lower are they?
Yeah, it's significant. We don't have exact dollar figures across the board, but look at psychiatrists. Only about 46% accept new Medicaid patients.
Only 46%.
Compare that to Medicare, where it's around 75%, or private insurance, around 69%.
That's a huge gap. It clearly shows the financial disincentive.
It absolutely does.
Yeah.
The economics just don't encourage participation for many providers.
And this connects to the workforce shortage too, doesn't it?
Yes, completely. On top of the payment issues, we just don't have enough behavioral health providers nationwide. Full stop.
And it's worse in some areas than others.
Much worse in rural areas. The provider-to-enrollee ratio can be dramatically lower in rural counties compared to urban ones. We're talking maybe 1.8 providers per 1,000 Medicaid enrollees in some rural areas versus 6.4 in urban ones.
Wow. That's a stark difference in access depending on where you live.
A massive difference.
Now, there was another issue. You mentioned something called the IMD exclusion. What's that about?
Yes, the IMD exclusion. It stands for Institution for Mental Disease. It's an old federal rule.
Okay.
And it basically says Medicaid can't pay for services for adults aged 21 to 64 if they're in a residential mental health or substance use treatment facility that has more than 16 beds.
Why does that rule exist? And what's the impact?
It dates back to the era of deinstitutionalization. aiming to shift care away from large state hospitals.
Yeah.
But the impact today is that it limits the availability of inpatient psychiatric beds.
So fewer places for people in acute crisis to get residential treatment.
Exactly, which often pushes people towards hospital emergency departments, which aren't always the best place for that kind of care and can get overcrowded.
Okay, so we've covered a lot of challenges: funding, workforce, disparities, the IMD rule. But it's not all bad news, right? Have there been any positive steps recently?
Yes, definitely. It's important to highlight the bright spots. The American Rescue Plan Act, ARPA, in 2021 actually spurred some really positive state-level action.
Like what?
Well, over half the states used ARPA funds to adopt or expand mobile crisis intervention services.
So teams that can go out into the community.
Precisely. To provide immediate support outside of an ER setting. And almost all states use the opportunity to significantly expand telehealth for behavioral health.
Telehealth really took off during the pandemic.
It exploded,
Hmm.
and psychotherapy and counseling were key services delivered that way.
Did that expansion actually improve access?
The evidence suggests it did. The flexibility, including audio-only options, was a big help for people in rural areas or minority communities facing barriers like transportation or stigma.
Audio only is important. Not everyone has reliable video capability.
Crucial point. And recognizing these benefits, many states are actually planning to keep these expanded telehealth options going even after the public health emergency ended. That could be a lasting positive change.
That's encouraging. And what about those racial and ethnic disparities we talked about? Any movement there?
There are some emerging efforts, yes. About 8 states reported specific initiatives to try and tackle these disparities.
What are they trying?
Things like improving data collection you can't measure properly.
Right?
And also promoting the co-location of physical and behavioral health services, often in community health centers.
So you can see your doctor and maybe a therapist in the same place?
Exactly. Makes it easier, less stigmatizing. Integrated care.
What about federal policy? Any shifts there?
Well, the current Biden administration is focused on strengthening Medicaid. They finalized some rules aiming to make enrollment easier and improve care quality.
Uh-huh.
But, federal policies can change depending on the administration, so there's always that uncertainty.
True.
We're also seeing more states looking at investing in the social determinants of health.
Things like housing, food security.
Exactly. Recognizing that things outside the clinic, housing, jobs, food, have a massive impact on mental well-being.
Okay, so looking ahead then, maybe specifically to 2025, are there particular risks we should be watching out for?
Yes, unfortunately, there are some significant potential risks looming. Federal policy is a big one.
Depending on election outcomes.
Depending on the political landscape, yes.
Yeah.
A potential Trump administration, for instance, might look at administrative actions like stricter work requirements for Medicaid or tougher eligibility checks.
Things that could reduce enrollment numbers.
Historically, yes, those types of actions tend to reduce enrollment. And beyond administrative actions, you always have congressional debates about taxes and spending that could lead to major cuts to Medicaid funding overall.
And what about the states themselves? Are their budgets healthy enough to sustain the programs?
State budgets look okay heading into 2025, relatively stable. But revenue growth seems to be flattening out in many states.
Meaning less new money coming in.
Right, which could squeeze budgets and limit their ability to invest more in Medicaid or even force cuts down the line.
And if those cuts happen, federal or state, what's the impact on the ground, especially for those mental health facilities?
That's where it gets really worrying. Those specialized psychiatric hospitals we mentioned, many operate on razor-thin margins. Medicaid often covers a huge chunk of their patients, sometimes over 90%. They might already be operating at a loss.
So any significant cut could push them over the edge.
It absolutely could force closures, and that would be catastrophic for patients with the most severe conditions, schizophrenia, acute suicidal ideation. They'd have even fewer places to turn for intensive care.
It's a precarious situation.
Yeah.
So given all this, the importance, the challenges, the risks, what are advocates and experts recommending?
Well, groups like NAMI, the National Alliance on Mental Illness, are very clear. They stress the need to protect Medicaid funding.
Their argument being?
Their core argument is that Medicaid is essential. They often cite that statistic. About 1 in 3 people with a mental illness in the U.S. rely on Medicaid. Cutting it would be devastating for access to care.
Makes sense. What about government oversight bodies, like the OIG?
The Office of Inspector General has made some specific recommendations to CMS, the agency running Medicaid.
Such as?
Key things include Increase provider payments, tackle that reimbursement issue head on.
Okay.
Expand coverage to include more types of behavioral health professionals, and enforce network adequacy rules more strongly, make sure there are actually enough providers available to enrollees.
Ensure the network listed on paper is real in practice.
Exactly. Real, timely access.
And finally, what about that coverage gap? The 10 states that haven't expanded Medicaid.
That remains a major policy lever. Expanding Medicaid in those last 10 states would be a huge step.
Who would benefit most?
Hundreds of thousands of low-income adults, many of whom are people of color who are disproportionately in that gap. It would significantly reduce disparities and provide a vital safety net, opening the door to mental health services they currently can't afford.
So wrapping this up, it's crystal clear Medicaid isn't just a player in mental health care. It's arguably the central pillar, especially for lower income individuals and communities of color.
Absolutely indispensable.
And we've seen progress, particularly with expansions improving access, but that progress feels fragile.
It does. Persistent disparities, workforce issues, and these looming funding threats really challenge the system's ability to cope with growing needs.
Which seem to be constantly increasing.
Constantly. So the tension is clear, progress made, but significant vulnerabilities remain.
Right. So when you put all this together, the data, the dependence on Medicaid, the inequities, the potential policy storms ahead, it leaves us with a big question, doesn't it?
I think it does.
And maybe this is something for you, the listener, to really mull over. Beyond the current ideas, beyond block grants or just payment increases, what truly innovative, maybe even unconventional solutions might we need to guarantee equitable, comprehensive mental health care for everyone, especially knowing how quickly the policy ground could shift under our feet?
That's the critical question. What does the next generation of solutions look like to build a truly resilient and equitable system? It demands some really creative thinking.